blood. Part 3, immunity system, also part of the circulatory system. Immune response. Immunity is the ability of the body to fight infections. Pathogens include viruses, bacteria, and any other microorganisms that cause disease. The skin, respiratory tract, stomach, and tears are all able to fight pathogens to a certain extent. Once a pathogen invades and starts to infect body cells, white blood cells are responsible for fighting infections. Invading pathogens have substances on their outer surfaces called antigens. Antigens are usually proteins, but they can be carbohydrates or nucleic acids. The lymphocytes are special white blood cells. They recognize the antigen and begin to take action. Plasma B cells. These produce antibodies. Helper T cells. These produce chemicals to activate killer T cells. So these are our activation. Killer T cells. They move to the infected area, bind with the pathogen, and then destroy them by producing toxins. Larger macrophage cells. These come along and absorb the killer pathogen complex, and this gets eliminated from the body as waste. Suppressor T cells. This is a third type of T cell. They are formed once the infection has cleared up, and they signal the immune system to shut down. Long-lasting memory T cells and memory B cells. They remain in the body. If the same pathogen should try to invade in the future, these memory cells cause the immune system to quickly fight against infection. So once you get an infection once of the same pathogen and you get sick again, your sickness is normally shorter and not as severe. AIDS. This stands for Acquired Immune Deficiency Syndrome. What it means. Well, acquired means a disease picked up from other people, so you're acquiring it. Immune deficiency is a breakdown of the body's immune system. And syndrome is a group of symptoms indicating the disease. AIDS is caused by the HIV virus, known as the human immunodeficiency virus. It attacks your helper T cells, which weakens the body's defense systems, because our T cells, if we remember, they're the ones that activate our killer T cells. So, if these aren't working right, then it can't activate our killer T cells. Symptoms of AIDS include fever, weakness, weight loss, pneumonia, and sometimes cancer will set in because your immune system can't fight against anything. So you easily get sick. You have to stay away from people that are sick. And once you are sick, it's hard to get rid of pneumonia or of a fever. AIDS is primarily sexually transmitted through the use of dirty needles by intravenous drug users. There are also other means of transmission. Monoclonal antibodies. Cloning. This is a technique where identical cells are duplicated and larger numbers of needed antibodies may be formed. An antibody-producing cell from a mouse is fused with a cancer cell, producing a new cell called a hybridoma. Hybridoma inherits characteristics of both cells, produces antibodies, and reproduces at the rate of the cancer cells. Antibodies formed this way are called monoclonal antibodies. Antibodies are grown in tissue cultures and given to patients. Antibodies only recognize infected cells, which makes it a really potential good research and good method of treatment. Monoclonal antibodies containing radioisotopes, drugs, killer toxins to cancerous cells are leading the research in this area. Chemotherapy harms cancerous as well as healthy cells, so that's why we're looking for other methods. Monoclonal antibody research is promising research, but it's not ready yet. Immunity. The two basic types of immunity are inborn and acquired. Inborn immunity, which does not involve antibodies, is present from birth and protects us from certain diseases and bacteria such as feline leukemia, a disease in cats. There are two types of acquired immunity, which does involve antibodies. Acquired immunity. So we have active immunity, in which the body makes antibodies. Active immunity results when a person gets a disease. The body produces antibodies to fight the disease. If the person comes in contact with the disease again, memory cells quickly produce antibodies, so the second infection is rare. Then we also have passive immunity, in which the antibodies are obtained from the blood of another person or animal. Vaccines. Active immunity can also be achieved if a person gets a vaccine. A vaccine is an injection of a weakened or dead bacteria or virus. They cannot cause the disease, but the body recognizes them as foreign and produces antibodies against them. Vaccination programs. Canada has a vaccination program where children are vaccinated at regular intervals. Some vaccines require periodic booster shots to keep the antibody level high. DPT vaccine booster shot is given to 16-year-olds. This includes diphtheria, which is a bacterium secretes toxins that may damage the heart, kidneys, and nerves. The P stands for polio, and it's caused by a virus and can cause severe cases in result of paralysis and deformation of limbs. And T stands for tetanus. A bacteria secretes a toxic that stimulates nerves and muscles to remain contracted. This is painful and may result in death. Active immunity develops slowly and is long-lasting. However, you must get the disease or a vaccine, whereas passive immunity is fast-acting, helpful when a person has been exposed to or is suffering from a serious disease, but it does not last. The body destroys the borrowed antibodies. Maternal immunity. Antibodies from the mother is passed on to babies from their mothers before birth and through the mother's milk after birth. It protects onto the babies from many diseases from the first few months of birth. Interferon is a protein manufactured by the blood cells that blocks the production of viral DNA when a cell is attacked by the virus. It provides great protection from viruses, but the human body does not produce interferon fast enough or in great enough quantities to be widely used. Unfortunately, interferon from other animals is not effective in humans. And that is the end of the blood, part 3.